Alrighty, let's go.
All right, welcome back to our podcast, Moline Method Mic'd. I'm Kelly Moline. I'm a pharmacist, functional medicine consultant, wife, and new mom.
And I'm Landon Moline, Kelly's husband, and father of our little baby Danielle.
Perfect. So we have a little bit of a hot topic today. We're talking about the Tylenol debate that has been released recently from the Trump administration, linking the association between Tylenol and autism.
Yes, very hot topic. A lot of opinions floating around, a lot of conflicting opinions. And so, yeah, I'm excited to kind of share our thoughts on it and a little more about the science behind it, since you are a pharmacist.
Yes.
And coming from more of the functional medicine side of things, I think that this is right up our alley.
Yeah, exactly. And so I'm going to explain more like facts and how Tylenol or acetaminophen works in the body, and talk about the studies, talk about the science. A lot of people, I think, with the conflicting comments on social media, talks about the science. So we're going to dig into that and see what it really says.
Perfect.
And I think, like you said, this is right up our alley. We're talking about medicine. Obviously, I'm a pharmacist, so I have my doctorate in that. And then we talk about stuff to new moms all the time. That's our specialty as well. And I'm a new mom myself. I was pregnant last year, so this is kind of fun to talk about.
Yeah, and this is one of the things that you actually thought of while you were pregnant.
Yeah.
So, let's just jump right in.
So the press conference in September 2025, so we're just recording this a couple days after that. So if there's more information released after that, I apologize. But the press conference talked about there was a new study that looked at 46 other studies that shows association between taking Tylenol while pregnant, and then neurodivergent disorders, including autism. So the press conference talked about that, and it also said other things like use caution, or I guess that resulted in the announcement, use caution with Tylenol in pregnancy, only use it for more emergency type instances like acute severe pain or a high fever, and then also not taking the Tylenol with the vaccines. And then, those are the big things revolving around Tylenol.
Yeah, I think the panel of doctors gave a really more clear and concise overview of their findings in the studies. I think that Trump's advice was a little more rough around the edges.
Yeah, it was trying to have a blanket statement. And so let's dig into that kind of after the sciencey part.
Okay.
And then we'll get into that. So how Tylenol works. I think this is important, that a lot of people are like, well, if you're taking a pain medication, how on earth could that affect autism or be linked with autism or have that association? So I wanted to dive into a little bit more of the science so you can understand it too in a digestible way. And I'm kind of using you, Landon, as my backboard, who does not have any sort of science degree or knows mechanism behind drugs. And we're doing this kind of new. I haven't expressed this or told you or explained this to you earlier. So you're really going to be the one that can make sure I'm being clear.
Mm-hmm.
Okay.
Yep.
So Tylenol or acetaminophen is a medication that's used for fever and pain. Okay. It's a
I knew that.
You knew that part?
Yeah.
That's great. Okay.
Let's dig
sports. A little deeper. So Tylenol, how it works. So we always have with medications our desired effect and then what is called like side effects, but they're all effects from the medication. But how the medication works, it works on the brain. So with our body, we have something called the blood-brain barrier. So it's like a security gate around the brain to help protect the brain from infections, big microbes, toxins, those types of things, okay? So a very small amount of medications, like 2 to 5%, I believe, actually cross the blood-brain barrier so it can work on the brain. But Tylenol or acetaminophen is one of those medications. So it works directly on the brain, and it stops the production of a chemical called prostaglandins. And the prostaglandins are chemical messengers that are going to have the pain response and the fever. So it's lowering pain and fever by stopping these chemicals called prostaglandins. Does that make sense?
Mm-hmm.
So that's how the medication works. It crosses into the brain and stops these chemicals from being produced, so you don't feel as much pain and your fever goes down. Okay. Tylenol is also processed through the liver. Okay. And so when we're processing Tylenol through the liver, what I mean by that is it's being cleared or detoxed by going through the liver so it can be excreted through urine or stool. Okay. That's how it gets removed from the body. Now, the liver has 2 phases of detox. It has a phase 1 and a phase 2. Okay. Phase 1 in the liver, it oxidizes it, which means it puts an oxygen molecule onto the compound acetaminophen, and then it actually makes it into a more toxic chemical in the body. And that toxic chemical makes it more reactive. But phase 2 in the liver, there's an antioxidant that is called glutathione, and that binds to that toxic molecule to neutralize it so it doesn't cause harm in the body. So then it can be cleared. Okay, so the medication acetaminophen, most of it can actually go through phase 2, which is just excreting it, making it water soluble and excreting it from the body. And that's no problem. A lot of drugs can do that. But acetaminophen, a small amount goes through phase 1. So it makes it into this toxic molecule, and then it has to be neutralized with glutathione, and then it can be excreted out of the body.
Got it.
Okay.
Yep. You actually explained that very well. I understood that.
Okay, great. So glutathione, I said, is an antioxidant, and it's like our mother antioxidant in our body. So it's the most prevalent antioxidant, and an antioxidant helps protect cells from free radicals or oxidation, which basically are fancy words saying like that protects cells from damage. Okay. So free radicals and oxidation typically causes damage to the cells. The glutathione is like a fire extinguisher that's able to put a lot of those out, neutralize them, and excrete from the body. Okay. So when we take Tylenol and it needs this component called glutathione, it actually uses up a lot of our glutathione in the body to make it non-toxic to be excreted.
Okay. So basically, the glutathione is used up a lot when we take Tylenol.
Yep. So it can use up our stores of glutathione.
Got it.
That is an issue if we're taking high doses of Tylenol or we're taking Tylenol over a long period of time because we're going to use more and more glutathione, right? Mm-hmm. Does that make sense? And glutathione does other things. It, detoxifies, it helps your immune system. There's a lot of things glutathione is responsible for, and to help protect the body. Do you know another time that glutathione is used up a lot?
No.
Pregnancy. Okay. So you may see where I'm going with this. So pregnancy, when our body is creating more and more cells, it also produces a lot of free radicals that can create damage to other cells.
When it's creating more cells, like in a baby?
Like for a baby.
For a baby.
Yeah.
Gotcha.
So these new cells are for a baby, and then other things that are going with pregnancy. We know that pregnancy uses a lot of nutrients, takes a lot of energy from the body. They compare it to running a marathon, that type of thing, right? Mm-hmm. So it's using up all this energy, and so it's also using up a lot of glutathione. So our glutathione stores are naturally going to be lower in that instance. And so when we're also taking Tylenol and our glutathione stores are even lower, and that is also needing glutathione, then our glutathione in itself can get super low. And when we don't have enough glutathione to neutralize the toxins, that's where we can also get damage in the liver, in the cells, in the brain. Okay?
Yes.
Okay. So did I explain that part?
Why can you get damage in the brain from having low glutathione?
So if we're not neutralizing the toxins, then the toxins could end up in the brain as well.
Got it.
Okay. And so that is how like the pregnancy works. Now let's talk about the baby inside the mom. Okay. So when the baby is developing, we talked about the blood-brain barrier in the mom, that security gate around the brain, right? That allows things to get through, just usually very little things. Well, that security gate, the blood-brain barrier in the baby, is underdeveloped. It doesn't work as well. Okay. And we know that the Tylenol goes through the placenta to the baby. That's been well documented already, that they do see acetaminophen levels in the cord, the umbilical cord after delivery. They can see that in there. Okay. So we know that the Tylenol, the acetaminophen, can go to the baby. Now, how it affects the baby. One, their blood-brain barrier doesn't work as well, so acetaminophen is definitely going to their brain. And then two, their detox pathways aren't functioning to a high level yet. They're still developing as well. So their ability to detox acetaminophen doesn't work as well, and so they could have more buildup that can cause damage to their bodies, to their liver,
Buildup
etc.
of what?
The Tylenol, acetaminophen.
Okay.
So when we have that buildup and not be able to clear it, we have extra of that toxic component, okay, that can't be neutralized and excreted. So that can cause damage. So that's one way that Tylenol can cause damage. And it's also, I've been seeing...
What is it causing damage to?
Liver, cells, brain.
Okay, so acetaminophen buildup can cause damage to the brain, liver, etc.
Yeah,
Okay.
and there are overdoses of Tylenol. We know that. The actual antidote to an overdose of Tylenol is NAC, or N-acetylcysteine, which is a precursor to glutathione. So
Okay.
I learned that in pharmacy school, that our antidote to Tylenol, because there are overdoses to Tylenol, that's one of the most commonly used medications to overdose in like self-inflicting type of things too.
Gotcha. So it's already like a pretty well-known fact that like glutathione gets depleted when you take Tylenol, and that's the antidote when you overdose on Tylenol.
Yes.
Okay.
Yep. So another component that I wanted to talk about with the brain is that we already talked about how it inhibits the production of prostaglandins, which takes care of our pain levels and fever, right? Prostaglandins also do other things in the body, right? As much as we want to say that one chemical does one thing in the body, that's not how it works. And we learn more and more about that as we learn about the body, medications, all of that, right? So prostaglandins are also responsible for neuron development in the brain and brain signaling and brain wiring. Okay. So when we are talking about the acetaminophen going to the baby's brain, and the baby's brain is newly developing, being created, all of that wiring is super important. And then you inhibit the prostaglandins in the baby, because you may think, okay, so Tylenol is going to the baby's brain, and so their fever is down and their pain is down. Like, why do we care about that? Well, the prostaglandins are doing way more than that, and it's also trying to do brain signaling, brain wiring, neuron development. And so when we're talking about babies in that phase, when it's creating a brand new brain, and if that gets off at all, that is where we could possibly have a link to neurodevelopment disorders. Do you see where I got there?
I see the connection.
Yeah. So I'm not saying that is for sure a cause. They're seeing more of that association, but I just wanted to explain the science of how Tylenol works and how we can see that possibly be linked to neurodevelopment disorders, including autism.
Yeah, that makes sense. It seems it has a direct impact on the brain, and so I could see where it could inhibit brain development. So I mean that, and again, I think too in the press conference, they didn't say that Tylenol was the only cause of autism. Like
Right.
they didn't say it was the only direct cause of autism. They said they are seeing a correlation between taking Tylenol when pregnant and autism cases. So it's not the only cause. There are definitely multiple factors that cause autism, but they are seeing a correlation between the two. So it very well could be a contributing factor to autism.
Let's get into the studies. So the study was, I believe, released in August. That was from Harvard. And that study is analyzing 46 other studies that looked into this. Okay. So they used PubMed. I read the whole study yesterday. So I encourage you to listen to the whole press conference if you haven't already, rather than just maybe biased headlines. And then two, if you're able to read the study, I think that may also shed light on the science behind it.
Yeah, that's a pretty big sample size when you're looking at 46 other studies.
And so how the study did it, it didn't just look at study compared to study compared to study. It actually like rated all of these studies as well on how biased this study is, if there's co-founding factors. It looked at the integrity of the study. And so they saw that the studies with higher quality actually showed more association between the Tylenol and the neurodevelopment disorders.
Got it.
So yes, there are studies that show it, and then there are studies that had no difference, and then there are studies on the opposite end where it says it may even be protective. Now, I will say the majority of the studies show that there's an association enough to the effect where then it would give a recommendation of Tylenol should be used in caution in pregnancy. And I say that too because Tylenol has been the medication that is quote unquote safe in pregnancy and has been recommended as the pain reliever and fever reducer in pregnancy, because we know that NSAIDs, including Advil, ibuprofen, naproxen, are harmful in pregnancy. We know that as a fact, where it can lead to birth defects and miscarriages. So we want to avoid those types of medications. And so Tylenol has always been the safer choice, which it sounds like it still is a safer choice. But I wouldn't say it's quote unquote safe. Like I talked to a lot of pharmacists and kind of just wanted to get their opinion on stuff like this. And so many pharmacists are like, oh, why would you even want to take that? Like, okay, yes, in an emergency, or if you really need it, sure, that's the medication to take. But so many pharmacists are like, just try to avoid anything you can, if possible, if it's not a dire need, because we know that medications do have effects, even over-the-counter medications that feel safe, but it's not just that black and white of safe or unsafe. There's this whole range of how safe is it, and we're getting more and more information.
Yeah, and I mean, like you said, it's been kind of deemed over the past, several years as the safer pregnancy drug. And so I feel like a lot of doctors, if you call in with a fever, that's what they're prescribing. They go, oh, take some Tylenol, right?
Right.
Yeah.
Yeah, they would say, take some Tylenol. Like, let's say you're messaging your doctor and you're saying, hey, I'm getting a little bit of a fever. I feel unwell. Or maybe in the second or third trimester, you're like, I'm getting very uncomfortable. And they message you back saying, you can take Tylenol. Right? Because they do want to give a response and they want to be helpful, and they may not think it's enough for you to actually come in, and that could help relieve that pain. And they want, good ratings and a good relationship with you too. So that's why they may be quick to say, just take some Tylenol. And I think the advice from this press conference is saying, don't be so quick to that answer and use it in more of a dire need than your everyday use.
Yeah, and I don't think the press conference was meant to shame those that used it, especially because like doctors have been prescribing it. So you're just doing what your doctor has said, and obviously trying to make the most well-informed decision for your baby. Well, now we have more information, which constantly happens in the medical world. And so now they're just giving this advice, this information, so you can make a more informed decision in the future.
With the study, I wanted to see how prevalent this was because like me and a lot of my pharmacist friends were like, why would you even want to take that if you didn't need to? So the study did say over 60% of women use acetaminophen during pregnancy for headaches or other pain or fever, with 20% of pregnant women using acetaminophen for more than 20 days. So that is used, I would say, like more commonly than we may think.
I'm
at
assuming
least I
that
would
rate
think.
has kind of gone up recently.
Yeah, that's what they're saying, especially when it was deemed quote unquote safe for pregnancy, right? So if it's safe for pregnancy, sure, take it, right? So that's why we want to like dig deeper.
And correct me if I'm wrong, but hasn't autism become more and more common?
That's what they're saying too, which they are also saying that part of that is going to be because the spectrum has widened. There's more diagnosis. They're screening for it more, which all makes sense.
Yeah, you're going to find more cases if you're screening for it more and you widen the spectrum. So.
Yes, exactly. But even with that, they are seeing, I think, more cases of the severe type of autism too.
Okay.
So with the science being uncovered, this happens all the time. I don't know how much people know that when a drug is released, they also do monitor once it's to the public to see how it's being tolerated from like a wider scope of people rather than just in the studies before it was released to the public. So that's kind of like the last phase of any study, because they're going to reach a wider range of people and then they can take it off the market if needed. So I don't think a lot of people know that. So even when medications are just being released, just know that in caution, they're still monitoring for other things. Now, obviously Tylenol has been around a long time. Yes, I think it's been the medication used, especially in the last couple decades for pregnancy, but there's always more information out there. So we're using science to gather more information. Did you know, and I'm not trying to directly relate the two, but this even comes into the fact where like cigarettes were recommended in pregnancy in less than 100 years ago. Did you know that?
Nope.
So it was common in the 30s to 50s that doctors would recommend cigarettes in pregnancy if they felt like the pregnant woman was gaining too much weight. And then,
why?
Huh?
Why?
Because it was like they thought that increased weight could have worse birth outcomes and that type of thing. So they were recommending cigarettes as a natural appetite suppressant. And we know that that can help some instances with the weight loss. So then they did that. So it wasn't even discovered until the late 60s and early 70s that there was a link with cigarettes and low birth weights and negative birth effects.
Got it.
So isn't that kind of crazy how there was a time that even doctors, even the medical professionals thought that cigarettes were safe? Thinking about it now, we're like, obviously that's not safe. Cigarettes aren't healthy for anyone, but that's how science evolves, right? We see this, we do the most with the information we have. Would anyone blame the mom in that instance too for taking their doctor's advice? No, I wouldn't.
No. And again, there can be multiple causes for different birth defects, different things. So like, just because like you did one of those things doesn't mean that you directly caused it. Like there could be multiple factors in there, but yeah, you do the most with the information you're given.
Yeah.
And that's all you can do.
And I think that's what our podcast we're trying to present with any topic we have is let's try to give more information to the moms where we don't get a lot of information from our OBs or from our doctors. We learn a lot from the internet or other people's experiences. And I could even do different things in my second pregnancy than I did in my first pregnancy. So that's why I'm out here trying to share what I have learned and what I've done through experience so that it would help more moms rather than have to dig all that time as well.
Yeah. I don't know. And maybe it's just an issue today. I feel like people just really don't like being wrong, and no one likes being wrong, but like they have such a major issue with being wrong, and it's okay to be wrong or to be misinformed, or so I feel like people reject new information just because it's not what they previously believed. And it's like, why wouldn't you want to be more informed and look into it and be open-minded about like new information? Because especially in the medical world, we get new information all the time based on different studies that are being done. So, and like, I feel like these drugs are not really even that old. And so they can be further studied, and their effect on the body can be further studied all the time. So, yeah.
Yep, exactly. So you mentioned earlier how I also saw this before when I was pregnant. And so I also decided not to take Tylenol when I was pregnant. So I wanted to share a little bit more about that, because I also got messages from moms saying, hey, I don't think this is new information. I also saw this when I was pregnant.
Yeah.
Why is this such a big deal all of a sudden?
Yeah,
right?
you told me that when you're talking to your pharmacy friends like about this topic, they're like, I don't really think this is new information.
Yeah.
So
And even I had a non-pharmacy friend also reach out to me, and she's like, I think I'm missing the mark. Is this new? Because I also avoided it a couple years ago when I was pregnant.
Yeah, I feel like it's more affirmation than new information. It's affirmation of like the theories that people already had. There just hadn't been a study on it.
And there were studies, but this newer study released in August looked at the 46 different studies, right?
Yeah.
So it had more data and gave a more conclusive answer for the association. And we're not saying association always causes causation, right? But there is that link. And when I was pregnant, I was looking at those studies, and it was enough information to me to say, okay, if possible, I'm deciding not to take Tylenol because I am seeing this link. And even if it's not cause, even if there's an association, but it doesn't cause the autism for sure, it was enough information for me to stop and say, I'm going to try other avenues, whether that's homeopathic, whether that's, I did a cold washcloth on my forehead for headaches. I did peppermint oil for my headaches. I rested a lot. I took naps. I try to listen to my body. I try to drink water, have electrolytes, all of those other things that are out there and can be helpful. Now, did it cure my headaches? No, I was very much like, I had a lot of days where I was in bed for a lot of the day because my headache was pretty bad, and I could have taken Tylenol in that instance, but I remember reading that and just decided that I didn't want to. But if I had a high enough fever or my pain was bad enough, I probably would have. So I just wanted to bring that. And yes, we're not okay. Yes, I see a lot of people commenting too how autism is not a disease. Very valuable people in our world are autistic, and I completely agree. And God made you exactly who you were supposed to be. And when we were pregnant, and there's a test at the beginning of your pregnancy that's looking at genetics, and then we can also see the sex of the baby. And I didn't even really want to do that test, and you really wanted to know the sex of our baby. So we decided to go forward with that test. But for the genetic component, I'm like, I don't even really want to know. Some parents want to know just so that they can prepare for it more. But I didn't really want to know because I'm like, I'm going to love this baby either way. So that was the case for us. And I think it's the case for a lot of people. But when I have the option of trying to reduce the risk of something like autism, I am going to take that route just because I want to make the best possible life for my baby as well.
Yeah, you were just trying to lessen the risk if you could,
Yeah.
based on the information that you had. And yeah, I mean, I think that makes sense. And yeah, I agree. I think that no matter what, we're all beautifully and wonderfully created, and like having autism doesn't make you any less perfect, any less beautiful. And so, yeah, I think there's definitely benefits into looking into any possible risks, causes of any kind of symptom or neurological disease. And I think that everyone's just trying to do the best with the information they're given.
Mm-hmm.
I know, I'm kind of rambling there.
No. And neurological disorder versus disease, I don't know if that matters as much, but
We can cut that last part because I was like, I lost my train of thought. I was going with it, but
no, that's good. Yeah, so that's just like where I was coming from. And there are some moms out there who do not care and don't want that information, which is fine. And some moms who do care and do want that information. So this information may not be for everyone, but I think it's just guidelines so that we can make appropriate decisions, weighing that risk versus benefit. Being able to talk to your doctors having more information so that they can present you with the best information, and then you can make that personal decision for you and your baby.
exactly.
Yeah. So that was all the science and mechanism of action and all of that I had. And I know you had some notes about the topic as well.
Yeah. I think piggybacking off the last thing you said, this information was presented as a kind of take it or leave it. It's just they're presenting their findings after they did this study, and if you don't want to use that information, you don't have to. Like, it's your God-given right and like freedom to do what you want with the information you're given. And I think that some people have had some really negative reactions to this information, and I've heard different arguments. I've seen different things on social media. And it's like, if you don't want to use the information, you don't have to. It's just they're trying to help you make a more well-informed decision.
Yeah. They're not limiting the use of Tylenol. They're not making it a
No.
prescription that I'm aware of. So if you have Tylenol at home and want to make your own decision, it seems like you're still free to do that.
Yes, you're jumping ahead into my argument. That's one of my okay, but I get some things that I saw on like social media that I want to just kind of like talk through and address. So I'm going to just go through a couple of the arguments. And one I saw was that Trump / like RFK are not qualified to get medical advice.
Sure.
And that was a big argument. Like, I'm not listening to them. They don't have any kind of like doctorate in medical, study. And my biggest thing with that is that there is a panel of doctors behind them. They are not the ones that were doing this study.
Sure.
They were just there reporting the facts. And with that, like what I said a little bit earlier was that, the doctors, I think, were more well spoken when they were explaining the findings of the study.
Completely agree.
I think Trump is a little more, I don't know how you say it, not abrasive, but like more.
He couldn't even pronounce acetaminophen,
Oh,
which
yeah,
wasn't great to start.
But people mispronounce things all the time. And so that's why I'm like, it is what it is. He doesn't come from that world. But the doctors were like, hey, this is not the only cause, but we have seen in the study that it could be, there are some correlations between Tylenol during pregnancy and autism. So they're like, take that how you will. And then Trump was like, don't take it. Don't take Tylenol. Yeah. And he's more like, I'm just going to tell you, like, just don't take it. And it's easy to say, but there are instances, like the doctors said on the panel, in which, like, if you have a high fever, and like if they were saying, if you can avoid taking it, great. But if you have a high fever, take it. So that's kind of, they're just saying like, avoid it if you can.
Yeah.
So like, there's a little bit of difference between Trump going, take Tylenol, make sure, don't take it, don't take Tylenol. And then the doctor saying like, well, don't take it if you can avoid it, avoid it. Mm-hmm. So that was the advice. So, but to say someone is not like, Trump and RFK aren't qualified to give this information. Well, they weren't the ones doing the study. They were just kind of like backing it up, or like,
backing up Harvard's study.
So don't be fooled. It's not them doing the study. This is not information that they discovered. So like, that argument I think is kind of invalid. The other thing I saw, which we were just kind of getting into, was like that democracy is being threatened because the president of the United States is telling us what to do, what to take medically, and what to do medically with our own bodies and our babies and all that kind of stuff. So a few things I have on that is that this is just fact-based advice off of a study they did. It's not a mandate.
Yeah.
We're not, like you said, we're not restricting the production of Tylenol. We are not making it so that you have to be prescribed Tylenol to take it. Like, it's still an over-the-counter drug, and you can do with it what you want. So, like, democracy, I don't think is being threatened here when they're just giving you more information that you can do what you want with.
Yeah. I will say there's a challenge on TikTok that pregnant women are taking Tylenol to, like, be in spite of President Trump, and which is ridiculous because you're hurting you and your baby from overdosing. There's been cases where people are overdosing and dying of Tylenol overdose to make this point, which seems pretty selfish and ridiculous. So I could see in the future if that kept happening where they would make this prescription because it became too dangerous. You know what I mean?
Yeah. No, but along the lines of, like, it not being like the democracy is being threatened. Like,
yeah,
we just got out of, like, kind of the COVID's still a thing, but, like, we just got out. And I don't want to go crazy into COVID, but there was, like, a mask mandate. You had to get a shot to go to work or to travel and things like that. To me, that was more of a threat to democracy when you were actually being mandated to wear a mask or to get a shot. This is just literally information that they're presenting. So to say democracy is being threatened here, but democracy wasn't being threatened there, is kind of a little bit hypocritical. It's a little strange to me that it's being, blown up in the media now versus like it wasn't back when we were being mandated to wear masks and get a COVID vaccine.
Yeah. And I think if the Trump administration said, hey, we now understand the cause of autism, whether that's genetic or components or whatever, and we can prevent this by just take this medicine or be injected with this, and it's going to prevent autism in your baby. Now, that's something I would have a problem with. So it's not necessarily the administration, like you're saying. It's just like what the information is completely different that we're dealing with.
Yeah. So with that, I think there are some questions that I'm like, here are some like good, healthy questions to ask yourself. Because I think certain thing, like sometimes depending on who's presenting the information, it's just being rejected because of the person presenting the information. Mm-hmm. So a couple of questions that I think people should ask themselves is, who is benefiting from this information? I mean, and I don't know, I haven't looked far into it, but like, I know that there were certain political parties that had stock in Pfizer and other, medicine companies that like they might have been benefiting from boosting, the COVID vaccine because then more people had to take it. It was being produced more, all that kind of stuff. But I don't know that. I think it might be a problem if all of a sudden I found out that like Trump was somehow affiliated with a competitor of Tylenol, and so that's why he's saying don't take Tylenol. Then that might be a problem. But like, I don't think that Trump stands to benefit, or even his political party stands to benefit from the reduction in people taking Tylenol when they're pregnant.
Yeah.
So that's kind of where I'm like, so he's just releasing this information so that people can make more informed decisions. And I think the only people that stand to benefit from this information are the people, the general public. So that's my opinion. I have to look into if he owns a company that competes with Tylenol, but like,
well, they're not giving alternative medication, and they are saying like it would be nice to have an even safer medication than Tylenol, but they're not recommending an alternative medication to Tylenol, which I think is like one of the big pushes. And then what I've seen online, which is kind of the argument or devil's advocate to what you're saying, is there was like a time constraint of they were going to have more information about the cause of autism by a specific date. So this fit that timeline. So I could like see that argument. However, they're putting more money into the research of autism. Again, I would have a problem if they were like, this was the cause of autism. And so we are now done and hallelujah, we found the cause. But instead, they're saying, hey, we believe that this could be a link enough so that we're reporting it and using caution with Tylenol. And then we're going to create more funding to have more studies done on the causes to autism, because like we said, we believe it's multifactorial. There's a lot of nuances with it. There's a lot of causes. And so they're diving deeper into that.
Exactly. Yeah. I do think it'd be irresponsible to not address like, okay, yeah, they're definitely, if they said they're going to come out with information by a certain timeline, time can be a biasing factor. And so that they might just release information just to release it. But the counter argument to that would be that they did have this study that brought in 46 other studies, and they had information to back up their research.
For
and
sure.
It didn't seem like time had a factor in those. I mean, I don't think that this study was rushed and just to get the information out. And again, like you said, they didn't say like, oh yes, we found the cure, we found the number one cause or the only cause. Like they said, this is a contributing factor.
Yeah.
So,
and I think the headlines attributed to that as well, because the headlines did say Trump found the cause of autism. And I think that was a big media grab and a big headline. So I see where people are upset with that. But if you actually listen to the press conference, specifically the doctors who present in the press conference, they're not saying that.
well, yeah, and that's why we're saying go back, watch the press conference yourself, and draw your own conclusions from it, because I think where you get your information from can be biased, and so that's where I think you should draw your own conclusions. Don't just take others' word for it. Don't just take our words for it. Go and do your own research so you can be the most well-informed you can be, because I think that's a major factor in like a lot of confusion today, is that the source that people got their information from could be extremely biased in one way or another. And so I think it's good to go and like research yourself, watch the press conference, or read the study. So the only other thing I was going to say was like, the third question to ask yourself is, why am I disagreeing with this information? Are you disagreeing with it because of the person saying it, or the political party that's, producing this information? Or are you disagreeing with it because like you have, fact-based knowledge that really disputes the information that's being presented? Because I think a lot of times people will just disagree with it because Trump's saying it, or people will just disagree with it because Biden's saying it. Like, remove the political aspect out of it and just look at the information. And I think that's the most healthy way to look at information. It's like,
yeah, it's unfortunate that it did become political, because this is our children we're talking about and the health of our babies. So I think every mom just wants the best for their babies and the best for our families. And so that's what this whole podcast is about. And so we're just trying to provide that information. And yeah,
and I
exactly
think
what you said.
a lot of the information can be diluted or taken out of context depending on the people reporting on it and where you find that information. So that's why it's important to like make sure you read the whole context and don't just take a snippet or a clip of something, because things can easily get taken out of context. And so those are like kind of the questions that I was like, this would be like, if you're really trying to limit your bias and really get the most out of this information, that's how I think you should look at it. And I think that's the most healthy way. And then do with the information what you want. It doesn't make you a bad parent to take Tylenol. And if that's what you decide to do, like that is totally your choice. It is, you have the freedom to do that in this great country. So that is totally fine. So like that's kind of where I wanted to leave that. But I thought those were things that kind of needed to be addressed.
Yeah, no, that was good. And so now you know more about the subject. I do plan to have an interview with a local naturopath and dietitian to also talk about the subject. She said she's been warning pregnant moms about this for a long time, many years. So I wanted to get her insight on this topic as well, so we can dive even deeper and have more of that knowledge behind us.
Awesome. Looking forward to hearing that.
Yeah, that'll be my first interview, so we'll see how that goes.
Sweet.
Okay. Yeah, so to wrap it up, Landon, do you have a dad joke for us?
I do have a dad joke. I thought it would be appropriate to make it medicine related.
Okay.
So,
give it to us.
Why don't yogurt and medicine get along?
I don't know.
One is probiotic and the other is antibiotic.
That's good. I was going to say something about probiotics, but I didn't see how it related, and now I do.
Yes, there you go.
I like it. Okay.
Awesome. Thanks for listening today.
Yeah.
Don't forget to like, subscribe, share with your friends, leave us a 5-star review, comment on our Instagram or our YouTube channel.
Yeah, our Instagram at Functional Medicine for Moms. You can find us on YouTube, Functional Medicine for Moms. Our website, molinmethod.com, where you can also see and purchase discounted supplements, high quality medical grade supplements. And then my email, kelly@molinmethod.com. I'm going to put all of that in the show notes along with the study that I was referring to today. And yeah, I hope you enjoy this. I hope it helped. And please share with other maybe pregnant moms or other people you're talking about with this topic.
Yeah, what she said. All right. Thanks. Bye-bye.
Bye-bye now.